Welcome back Sunbro. We hope you all in great health and great money. Before we start, please at least subscribe so we can have little money for food and paying bills. Alright, today we are going to talk about seasonal allergies. Here's what you're doing wrong. 1 in 4 Americans deal with seasonal allergies, but many use their meds wrong, especially with climate change boosting pollen levels. Allergies are your body overreacting to harmless pollen. Your immune system releases histamine, causing sneezing, itching, runny nose, watery eyes, and more. Tree pollen peaks in spring, grass in summer, and weeds in fall. Indoors, mold, dust, and pet dander can also trigger symptoms. Here's how to actually get relief. 1. Start meds early. Don't wait for symptoms. Begin meds 1 to 2 weeks before allergy season to prevent flare-ups. Tree pollen February to April, grass April to June, weeds August onward. 2. Target the right symptoms. Use the right meds for what you're feeling. Decongestants for stuffy nose, short-term use antihistamines for sneezing and itching, and steroid nasal sprays for inflammation. For stronger symptoms, combine nasal steroids with antihistamines. 3. Use sprays correctly. Lean forward, don't tilt back. This keeps the spray in your nose, not your throat. Don't use decongestant sprays like oxymetazoline Afrin for more than 3 days, they can cause rebound congestion. 4. Stay consistent. Stick to your daily meds, even if you feel better, so inflammation doesn't return. Nighttime use of antihistamines like loratadine or cetirizine may help with morning symptoms. 5. Store meds properly. Keep pills in a dry place like your bedroom. Avoid bathroom humidity. Don't refrigerate liquid meds unless the label says so, cold can weaken them. 6. Reduce exposure. Check pollen counts, use HEPA filters, and allergy-proof bedding. Wear a mask for yard work, shower after, and wipe down pets before they come indoors. 7. See an allergist if needed. If symptoms last for months or lead to infections, see a specialist. They can identify your triggers and offer stronger treatments like allergy shots or immunotherapy. Allergies can be tough, but with the right approach, you can breathe easier and stay ahead of the symptoms. Thanks for watching, Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.